Hi, everybody. It's Elle, creator of the Happy Birthday Program. If you have not watched my video on Healthy People 2030, I would suggest watching it just so you have more background on this subject. Today, we're going to be talking about the maternal mortality review, and specifically the pregnancy-related deaths data from 14 U.S. maternal mortality review committees from 2008 to 2017. So as you notice, there are only 14 U.S. maternal mortality review committees that they got data from. So I know in Nevada, we didn't have a maternal mortality review committee until I believe 2019. So we were not involved in this. This is going to be other places, but the data should stay pretty similar. So the key findings. Approximately 1 in 3 deaths among women during or within a year of pregnancy were pregnancy related. Pregnancy-related deaths occurred during pregnancy, delivery, and up to a year postpartum. Leading causes of pregnancy-related deaths varied by race and ethnicity. And 2 out of 3 deaths were determined to be preventable. 2 out of 3 women died who did not need to die. Now, I am not a physician. I am not a nurse. What I am is an occupational therapist. And really, what we are so great at is using social determinants of health to prevent things like this. We are very good at preventing illness and injury and disability. So, how can we help? Well, the first thing we need to know is, why are women dying? What are the specific issues? And we know that it varies by race and ethnicity, so that's going to have an impact as well. If we scroll down, it breaks it down. Leading underlying causes of pregnancy-related deaths overall and by race and ethnicity, data from 14 maternal mortality review committees. So over here we see that we have non-Hispanic Black, non-Hispanic white. For non-Hispanic white individuals, the leading cause of death, you can scroll down, 14.9%, mental health conditions. What are mental health conditions? Well, that's going to be things like suicide or drug overdoses. So why does suicide happen? Well, it can be because of psychosis. It can be because of depression. It can be anxiety, PTSD. It can be OCD. There can be any number of reasons that lead to suicide. And we know that hormones changing doesn't help. There are also a lot of demands on new mothers, and the economy in 2008, 2009 was difficult. So there are a lot of things that we need to look at. But we know that that is a serious issue. We can also look at among Black individuals, mental health conditions are not, they're not written specifically right there. So for whatever reason, maybe that's because they didn't hit the top amount, the top, what they put 1, 2, 3, 4, 5, like 5 or so on there. But we do know that mental health conditions, they don't care about your race, they don't care about your ethnicity. We all have those issues, and we have some things that are protective and some things that can cause more issues. So what we want to do is we want to change what we can. Now, the other things, the thing that is most common among Black women is cardiovascular conditions and hemorrhage. So hemorrhage is preventable. That's one of those things that we can absolutely prevent. Something as simple as weighing your pads. If you weigh your pads, there are guidelines that can tell you if you're losing too much blood. Now, I'm not talking about during your period. I am talking specifically after you have your baby. That is something that can tip you off to whether or not you have a problem. And that's something that, we could do. A lot of places do that, and we tend to not do that in the United States. But because my focus is specifically on mental health conditions, I just want to talk about how preventable postpartum depression, postpartum anxiety, postpartum PTSD, postpartum psychosis, all of those things, how preventable the deaths related to those are. Now, I'm not going to be talking about substance abuse, that's not something I'm going to be talking about, but that's part of it as well. Now, I know specifically in recent years, there's been amazing research that has shown preventative measures to help prevent PTSD. And I also know of some, although this is not my main focus, I know of some preventative measures that can help prevent postpartum depression, postpartum anxiety, and at least, even if you develop it, help you deal with it and help you from developing another mental health care condition, another mental health condition. So how do we do this? Well, I have videos about this, so please watch those. But really, what it comes down to is addressing stress. So, addressing the traumatic memories, trying to prevent those short term traumatic memories from becoming long term traumatic memories. It is trying to reduce stress. There's various methods, whether it's breathing, yoga, mindfulness, etc. And it's also about having things like skin to skin contact between mom and baby within the first hour of giving birth. You want to have skin to skin contact with mom and baby for an hour to 2 hours. There are actually 9 phases that the baby goes through. And if you have skin to skin contact through that time period, it is really good for baby's development. It helps them regulate their breathing patterns, their body temperature. And with us mamas, it helps us regulate our mental health. It's been shown to help prevent postpartum PTSD, depression, and anxiety. So, that skin to skin time is so important. And that's something that you can advocate for before you ever go into labor. You can talk to your physician, your obstetrics care provider, about your plan, your birth plan. And I recommend that birth plans be pretty minimal. You don't want to have tons in there. And I also recommend that it be a flow chart rather than like a list of demands. And the reason why I recommend those things is research is showing that if you have like a very detailed birth plan, women tend to get PTSD at higher rates when they do that. Because then you think about it, there's going to be more of an expectation of what you're going to have for your birth. And then if something goes wrong, that it's just that much more difficult. But then there's also the fact that people that have higher like stress, like just natural occurring stress, more anxiety, they're the ones who tend to really want those detailed plans. So there's a lot going on there. But kind of submitting yourself, right? Just like letting it over to the process. And I mean, being vigilant, watching after your health, but not hyper vigilant, can help. And so I recommend speaking with your healthcare provider, your obstetrics care provider before you have the baby about if you want an epidural, if if you want to have a episiotomy, or if you're open to it, or you really want to avoid it. Just various things. There can be so many things, like if you want the lights turned low, do you want the baby on you right after birth, and for how long? Those are all things. If you want to have your partner cut the cord, there are all sorts of things you can discuss, and your healthcare provider should be well versed in all this and should be able to help you through the process. But, with your flow chart, just have on there that you want immediate skin to skin contact, and talk to your physician about how important that is to you, or your nurse midwife. And in fact, in my experience, it's the nurse midwives who are better about the skin to skin contact. And of course, that's partially because nurse midwives don't typically get the complex cases. Usually, it is physicians. They are the ones who end up getting those cases. And when you have a cesarean section, it's more difficult to get that skin to skin contact. However, there's also been a lot of research about that, showing that skin to skin contact in the OR can be possible and safe. So that's something to discuss also with your healthcare provider, and maybe together you can explore the research and whether that's a great idea for you or not, whether your hospital even allows it, because it might not be up to your primary care provider. All right, you guys, I hope this was helpful just to get a basic understanding of some of the issues that moms are facing and why it's so important that we look after mental health. It is quite literally a life and death situation. So prioritize your mental health. All right, everybody, good luck. Take care. Bye.